So this is how the assessment is going to read like. So this is how the assessment is going to read like. Okay. So candidates briefing, you are a registered adult nurse. So let's say that for today's discussion, we are using an adult nurse. You are a registered adult nurse working in an emergency department. Please conduct a holistic assessment of the patient's physical, psychosocial, spiritual, and sexual care needs. As part of your assessment, so pay attention as I'm reading, every part that has been highlighted in bold is important for your assessment station. So these are some of the tips that we are learning to be able to pass our OSCE on our first attempt. Every part that has been highlighted in the scenario is important, and you're going to need it to be able to pass on your first attempt. So please conduct a holistic assessment of the patient's physical, psychosocial, spiritual, and sexual care needs. So they've been highlighted. So you need to be able to do those assessments. And then the reading continues. As part of your assessment, please complete an A to E assessment. You realize that part is also highlighted. So you need to complete the airway, breathing, circulation, disability, and then exposure. That's why they've been highlighted. If you fail to cover even one of these in the bracket, you're not going to be able to pass your OSCE. The reading continues, and take and read vital signs. So the vital signs, the temperature, pulse rate, oxygen, respiratory rate. So have also been highlighted. You need to vital signs and then chart them. And calculate a warning score. That's the new score. Also been highlighted. You need to calculate news score. So finish with all your assessments to check the patient's new score. That's to allow you to pass. So depending on circumstances and condition, you may wish some areas of assessment in more depth than. Please take note that there is no need patient's clothing to assess exposure. To exposure, the assessor is not expecting patients that you are going to take off their clothes. Make sure on the OSCE day you do not. Right. Has been checked, calibrated, and is clean. An observation chart is provided and must be completed within the state of the the observation chart and also the GCS chart, most especially for the adult nurses. It must be completed using a green pen, 20 minutes to complete this, including the completion of the following document or the following documentation. So the news chart, and then assume it's today, it's 1000. You see the today and then 1000 important. Any OSCE station that you are doing, when you see today and that has been given to you, if you have any you need to do in your OSCE, whatever station that you are completing, make sure the time that has been given is the time you use your documentation. Say that, oh, you've done or you finished maybe 2 p.m. Therefore, you are going to do your documentation. That make sure you always go back to and then use the time that has been scenario. So this is the brief that will for your assessment. Now let's check some. So this is the overview of the recent history. So details of your patients. So Siobhan James, date of birth, 092, hospital number is there, address is there. And then the presenting complaints. Patient has presented to the facility. vaginal bleeding for the past 2 days, pelvic and shoulder to pain, diagnosis. So patient is going to go through the salpingo oophorectomy. So patient is going to go, the past medical history will 6 weeks pregnant, in vitro twice in 2 years, iron deficiency anemia, and then the past medical history of a patient. The patient currently lives with a partner, does not smoke or drink, and currently supplements. Patient is independent with all her needs. She has failed IVF twice, and this is her third IVF. So drug history, patient fumarate, folic acid, clarithromycin, and for the pain. And patient has no allergy. Part of this patient that you have, you will also have these sheets provided for you so that you can use the documents, any documentation that you need whilst you are going through your assessment. This is not going to be marked, and so you know that you want it. So for those who talk, I'm currently showing some, that's a condition, ectopic pregnancy. If you are happy, you can join us on YouTube, have a look at what I am reading through. But if you have any, you can also drop it in the comment section. I'll answer them. If you've just joined us through the NMC area to be able to patients and what the assessors looking out from us for us to be able to pass attempt. And our first discussion we have, so we've just read the brief to us and then the patient's history. Looking out for other documents that will be added. So this particular sheet will be given to the airway, the breathing, circulation, and then exposure. So this is also for those who would want to pass their. When you forget what, if you have a thought block, this page, you realize that your assessment with the airway, and the next thing to do is to do the breathing, circulation, you do your disability, and then you do your exposure. So even if you forget, this for you to be able to go through and then cover everything that is needed. For those on TikTok, please tap on, as the live may not be able to hold no activity. So please, for me if you can. Documents is also going to be added. Candidates notes, so you are just going to be taking the note. This documentation is for your use and not going, as I mentioned earlier. So you have the physical, social, spiritual, sexual needs. So you remember when these parts were highlighted. When you finish with the A to E, so have to cover the physical, spiritual, sexual care needs. And then this is the extra document that was stated in the need to complete this sheet. So this is the sheet that you will patient's vital signs on. So you see they have the full name of OSCE, they have the date of birth, they have all those information will be, and now you have the date and time. You need to have that date. OSCE, that date is what you write there. You have the time. That time, what I'm talking about. Yeah, so the time is going, I mentioned when I was reading. So I'm repeating the mistake to write the time you have finished doing the assessment. Go back to the scenario, check the time, use that time. So the there, you need to chart the patient, and then the S to chart that as well. The air or oxygen, that, and then blood pressure, you need to chart. And then the pulse. This is where you chart the pulse. Consciousness. This is where you chart whether or not. And the temperature, you write as well. Now the total new. You remember when we were reading the scenario, it was still you need to check the total score. So they're expecting you to score there and monitoring frequency. How often are you going to patient vital signs? You need to have escalation, whether you're going to escalate or not, you need to have it, and then the initials, you need more. So all the documents you need. So this is what is going to inform you to monitor the patient after you've gotten your news total. So these are all the documents you'll be for, or you're going to need for your station. Now let's do criteria and then check. The assessor will be looking when you have been asked to perform station. Need to complete an assessment station with it's in the brief. We are supposed to do A to E, supposed to chart the patient vitals. We are supposed to calculate the new score and to do the holistic assessment, that's psychosocial, spiritual, and sexual care needs. So now let's go to the marking criteria and then have a look at what criteria says. What the marking criteria is going. Right, so that's here. And so this is also another advice that you are always using the updating criteria. The UK NMC keeps on making, and so make sure you are using the updated marking criteria. Let's go to the assessment and then see what's the assessment. So assessment. So we have one all the way down to steps. That's you. Now reviewing the marking criteria, the assessor will have by then, and so it will be on their side, or they will, or it will be on their top that they will be seated behind it to mark it as you are performing the assessment station. They are looking every step they take. So they expect you to cover all the we are going to go through. Is assess the safety of the privacy and dignity of the patient. So how do you do this? You ask to the assessor that the scene is safe and you are going to provide the dignity to your patient. That's it. Once you are able to verbalize, you are good to go. Don't forget, we are saying that making sure that's our OSCE on our first attempt. We are not there to improve. We are only there to make sure that what the marking is what we are doing. So you hear that people will be saying they will take maybe they will take any fluids from there. They will. These are all things you can add. But what the assessor to hear is that you will provide privacy, and you cannot always predict going to be. So just tell the assessor you will provide privacy. Next one, you need so cleans with alcohol hand rub or wash and dries with paper towels. guidelines. So the assessor wants to also see you perform, whether you water or whether you're going to use the alcohol swab. But I would advise you that do not the hand hygiene with soap and water, because of time. Just quickly pour the into your palm and then perform hand hygiene quickly. That's another tip. Then the next one, introduce yourself. So who are you, patients? You need to introduce yourself to your patient. Hi, I'm Nasima, attending nurses for today. As we do not have a lot of time, so we don't have to quickly, and you are good to go. The next one is the first, checks identity with, so you are asking about the patient's and then birth or hospital number. Verbally is the wristband where appropriate. And every patient is going to have a wristband in the hospital. If they are in or the community, they are not going to have a wristband. So if they are in the hospital, you have patient's details against their. By first asking the patient, please confirm your name, date of birth, and then if possible, their hospital. So it says or hospital number. So either of them. Then the patient will tell you their full date of birth. Mention whilst you check against the wristband. Once saying it, you need to now check against the wristband. Do not just verbalize it. You confirm, you check with your document as like you are looking at your document to confirm. Once you do that, you are good to go. That is checked. And now the next point says checks the allergies and on wristband. If is having allergies, they are going to have another which is going to be red. But every patient is going to wristband when they are in the hospital. For allergies verbally and on wrist. So can you please confirm have any allergies? If yes, what's the reaction? So if patient says they've got allergies, you inform your documentation as well. Then you check the wristband. Okay, that's it. We are good to go. It's already checked. The next one, and explains the reason for assessment. Tell the patient why you are there. You come to me. Tell the patient, so your A to E assessment is, and can I go ahead? Can consent from your patient. Now, patient, yes, you can go ahead and do it. So you may want to ensure that your patient is safe, is not in any pain, so you can ask those questions. In any pain, are you comfortable? Can I go ahead? Right. Now you've sent about the reason, handing you are there to, and then the patient has given a consent, yes. So once you've done this, the assessor you from 1 all the way down to 6. Now the 7th point says a calm voice. Body language is open, appropriate. So personal space means that find yourself all around. Give your patient some space. The assessor, and then make sure you rushing through. Make sure that what you are saying understand and will be able to respond to you. Body language is open. Do not go and then fold your hands or okay. That's a clue. Conducts an A to, and for the A to E assessment, the assessor is expecting you to start. Airway looking for. The assessor are checking if there is any visual in the patient's airway. How do the patient to either cough or just as you are speaking with them, you can confirm the instructions, and then that is it. You are done with breathing. So you move on to the breathing. Respiratory rates. The assessor is when you check the patient's respiration, you get what is the patient having normal rhythm? Is the patient having a normal depth? Oxygen saturation level. Assessor is expecting you to check the patient's oxygen saturation. And then the respiratory noise, having any difficulty breathing, so you can hear noises. And they've given you examples. So you can be the only one to observe, to verbalize it to the assessor. The assessor will know that, okay, this is the reason why not pass the OSCE, because they believe exams I just have to perform. No. The assessor will not know that even for rattles, wheezing, the assessor can only mention it that this is what you are looking for. I hope it is making sense. There is a way that we are able to go about this in our training, whereas you begin refill, when you move away from capillary refill, that you are going to check you are going to check the together using 2 minutes. So the assessor wants you are checking the pulse for a full, and you are checking the respiration minutes. I've seen because they fail to wait 4 minutes for the pulse, and they fail to wait for that one respiration. Do not it. This will prevent you from passing the first attempt. So hold the patient's hand. After you've done with the capillary refill, hold for 1 minute. You move on. So for you to be able to take the time with the assessor, once you tell the assessor, my time starts now. The assessor will now be monitoring the time with you. Only way to communicate what you are doing. How do we calculate the 2 minutes? So you'll be given the watch, or you can take yours there, watch. So when you are looking at it, hand, now you can check with exactly the second hand is, and says assessor, my time starts now. So the assessor will checking the time with you. Once you tell them starts now. Once you tell them your time starts now. No, you don't need a degree. So back to checking the pulse and respiration. The assessor is monitoring with you. 1 whole minute, assessor know that, okay, you finish with pulse. The thing is, if you fail to now take your eyes off from the and then begin to observe the patient, assessor will not pass you because you cannot check respiration with the chest. Candidates have failed. So do not be part. Make sure that once you take your hand, do not take your hands, hold the patient's hand, but then you now have observe the patient's chest. For the assessor, 1 minute for the pulse is done. You are now pushing. This is the only trick. This is the only trick. So for those on taking part of the community, please do what to follow me. Come alive. You will be able to join, and then everything about the UK NMC, and then through and reviewing every station, you'll be able to get fully prepared and then in your first attempt. For me. All right. So now let's get back to it. You've checked the pulse, you've checked the respiration. Criteria. The assessor is expecting you to see the respiration. What was the so your respiration was, let's say, 18 minutes. Did I have a normal rhythm? You have to mention it. My respiratory noises, you need to mention that as well. And then unequal air entry, mostly you can use the scope for that, but then you can verbalize normal air entry or and then visual signs for you need to also mention that you could see not using any accessory muscles, such as maybe no, unfortunately we are yet to begin. We will announce that later. So such as maybe having maybe accessory muscles or having a seesaw breathing. You'll need to mention this. If you fail to mention it, you'll not be able to know that you've checked. So that is why we say verbalization in your OSCE. Everything, verbalize it. Verbalize it. Next one is circulation. You've done the breathing and then you've checked the respiration. The pulse to the assessor wants to hear what was the rate. 85, maybe 75. Did the patient have normal rhythm? And then to mention that. And then you move on to check the patient's oxygen saturation after your capillary refill. So oxygen saturation 97 or 98%. Well, when you check and you do not verbalize, no. Okay. Is the blood pressure. Blood pressure. Check patient's blood pressure. Covering the patient's arm with at the adult cuff, and then you cover that. Patients, you check the patient's blood pressure. So that, please, if you don't know, you wouldn't fail the units because the assessor will chart them in the, but it's advisable for you so that the assessor can follow everything you are doing. So that also brings me to another that you can use to be able to pass your OSCE. Make sure that whilst vital signs, you do not quickly chart them in the chart. Make sure you just on that scenario they gave you, the assessor gave you, realize that this is where it said that airway breathing observations there, because to transfer that onto the observation chart. For mental health OSCE, no, we are yet to involve and assess how much do you teach for the OSCE class. So you need training or guidance on the OSCE. You were to send a DM to me on TikTok or check my last post on. I have the number on TikTok. Just reach out to me on that. Happy to add you to, which is going to begin September 7th. Let's get back to the so now you've checked the circulation, you've checked the patient's vitals. Now get into the disability. This is what the assessor is expecting to hear. You check the patient's, if patient is conscious, you need to check the, but definitely patient is conscious because you've been talking about the procedure. Make sure if patient is, if patient is in any pain. So you need to be asking your patients, do they know where they are? You need to ask them, where are you? Let the patients confirm. Once the patient says, assume that they know where they are. Some patients may be. So you ask them, where are they? And then you ask them if they are in any pain. If you move on, if they are in pain, you know how to address pain. And then ask if they've checked their blood and if they've used or opened the bowels. What the assessor is expecting to hear from you. Next one is exposure. So for the assessor wants you to now temperature of the patient. So it takes the temperature. So for that, you have a thermometer. So you just point it to the patient's forehead, then you take it. But you need to check the that you are using. Verbalize to the assessor that is clean and there are no infections. Happy to use it. Now, the exposure, the assessor wants to hear patients if they have any bleeding, any rashes, if they have any bruises, or any, the assessor wants to hear that as well. And now the point 9 says that measures and documents vital signs and specific tools. So brings us to the point that was made, the observation chart. If to even indicate one, the variables, or one, that alone will not allow you to. And please, I want to start. How much should I pay? Just kind of me on the WhatsApp number that I just posted. To get back to you on that. So make that you have completed that as expected of you. Look at the observation chart shortly, and I'll show you need to complete. If you fail to even when you finish with everything and you fail initials, that alone will not pass. So like I said, preparing ourselves to be able to go and then pass. And so everything I've session is to make sure that you do not, that will not let you pass. Feedback of candidates who have gone that I'm sharing with you. Also reviewing the marking criteria, you change from the assessor. Okay, so next, calculate and record scores accurately. That is score comes in. And then accurately completes date and time on the assessment chart. Individual points that you, if you fail one, it. So how could it's just for dates, time, and nature? It is very important because every procedure performed in nursing that has not been done. It doesn't matter if you spend 18 minutes doing all of these assessments we've discussed, but if you that will not allow you to pass. Conduct a holistic assessment patient scenario. Holistic assessment. Now, back to the patient's observation history that we read from the scenario. Confirm from your patient by each of those sections in the bullet point. Ask patients about the presenting if they are true. Admitting your patient. So you need to know the data that you have, whether all the information there is exactly as they said they are. About presenting complaints, ask about the social history, current medications that they are on, ask if they have any allergies. That is the whole. And then if the patient needs extra assistance, maybe patients with maybe after they need help to be able to cope and then rehabilitate, you may need to refer them to the units. So you need to also refer the patient, and hopefully maybe want to refer your patient to the team. These are all areas that we depth into it to be let our patient and our candidates know go about with this. So if you are joining in, we assure you that this is how we are, that you cover every station with ease. Right. Hey, thank you for the roses. It's been a while. Now let's go to the conductive holistic assessment. Once you finish with the holistic assessment, ask your patients about their physical, psychosocial, and sexual care needs. You to cover all the points that stated in the overview. That's what I want you to cover. And then dispose, do another hand hygiene to station. And the 15th says that professionally throughout the procedure. So there that you will be talking over. So you are going to act as can. Let your patient on their health. Right. So that is that for assessment station. And so let's quickly have a look at the observation I was talking about. So if the 300 and the rest, so unfortunately we are not today. Hopefully we will come back to sometime. So let's make sure that at least today, if we are even able to cover the assessment, that should be okay. And then our subsequent meetings, we'll be looking at the planning and the rest. So now we can say that we've covered all those highlighted parts from the marking criteria. Now let's look at the observation chart. Right, so these are the areas that I was saying that if you fail to indicate, you may not pass. So the time and then the date. The date is the date that you are doing your OSCE. The time is the time that has been given to you in the scenario. So quick quiz. I'm taking you back to the scenario. Is anyone able to type in the comment section, especially for those on YouTube, because they're the ones that can see the scenario? Can you tell me the time you are going to write on the observation chart? What time are you going to write on the observation chart? So for those on TikTok, this is what it says. You have 20 minutes to complete this station, including the completion of the following documentation: news charts. Assume it's today and it is 1000 hours. So what is the time that we are supposed to write on the observation chart? Good. Who else? What is the time you are expected to write on the observation chart? So let's say you did your OSCE in the morning. All right, good. So it means we are following. It is 1000 hours. It is 1000 hours. If you fail to write that 1000 hours and you write the time that you finish with the assessment, unfortunately, the assessor is going to mark you down. I'm glad we are following. All right, so let's get back to the documentation sheet. So make sure that every that you select, you do other box, because every box is for observation. So let's say you are taking observations in the morning. That is the you are taking the observation 1000. Do not go into the boxes for another time for an observation. Right. So you have the time, then the respiration. That's the respiration. Also, when you are charting the elements, or when you are of these observations, mistakenly in the incorrect box. Vital signs we checked 19, where 21 to 24, against 18 to 20, against 15 to 6, or against 12 to 14. is 19, supposed to chart it. 21, 18 to 20, 50, or so I've got 18 to 20. Who else? It's 18 to 20, good. So how you go about it. 18 to 20 because 19 is between and 20. Now for the next, the oxygen saturation. Now you see that we be SpO2 scale 1 and then we 2. If you want to pass OSCE on your first attempt, no way should you attempt your oxygen saturation in. There is no way to attempt to write it in the scale 2. The scale 2, it's specific reasons. Scale 2 under the qualified clinician. So we are only supposed to use. Right. So let's move on to the next, the air or oxygen. So if you're not on oxygen, then it's just letter A. You're supposed to write just letter A because patient is on room air. Next one, blood pressure. So blood pressure, and then we have the diastolic. And then we have the diastolic. So as you can see, 19, and then above 220, and all the way down to minus less than or equal to 50. What that is. One thing I also want to let you be aware, when you are charting the observation, make sure that you do not use dots. Can anyone tell me the reason I'm saying or I'm advising that you do not use to indicate the vital signs that in the comment section? And if you are still watching and you've not followed of the platforms, please do well to follow me community to be able to, especially colleague nurses and midwives, to be able to join the UK NMC register here in the UK. For those who find themselves already in the UK, if you have not followed me yet, and if you've not shared a page yet, do well to share to them so that we the recent information from the NMC. So not know the exact number you are using. Exactly. That is the main reason I come to you when I say that, oh, are you vital signs for today? And when I look, I can only see dots, dots, dots. So I'll be asking, so what exactly is the response? Let's say you've indicated the dots between or against 18 to 20. How exactly 18, or if it was 19, or if so, this is also another tip. Right, so we were on pulse. So consciousness, your patient, so you write A in front, and then the temperature. The temperature, see that we have equal to 39.1, and then 1 less than or equal to 35. So make sure you know exactly where you are writing your temperature. And then the news total against it. So we later to maybe discuss how news total. But what new means is that you see the middle of the chart. You can see there are some numbers there. You have 3, 2, 1, 3, 1, 2, all the way down to the last, which is a. So when you take every, so let's say the respiration, and you, or the patient's vitals, or let's say the patient 22, we know that it's in front 21 to 24. Look at that and you trace it to part of your chart, you can see that it's matching the number. Those on able to see the real is against, or it is matching against the two. The real see it is. So you are going to, for all the other parameters, that's for all the other parameters, and when you will now have to add the corresponding keys or middle, and that is going to be the total news. Then you write the total news. One monitoring frequency can here. So this is the, and then the monitoring frequency, and then the claim. It is always going to be given to you, so you don't need. If the news score is 0, the monitoring, you need to monitor the patient 12 hourly, and so you continue the news monitoring. Total is 1 to 4, you need the patient 4 to 6 hourly. If 3 in single parameter, you need to monitor hourly. And then the clinic, it's either you're going to escalate the care, you are going to not escalate. Anything that is 1 to 4, as a registered nurse, you use your, whether you want to escalate. But if it is 0, you do not escalate. 3 in single parameter simply these parameters that we've looked at. If one of them gets the news of 3, it doesn't have news score, you still have to this means. So that is to also escalation of care, either yes or then the initials you write. So this is simply how to news total. So I have been able to cover the assessment